Hi, my name is Trish Gibbs. I started working with Chronic Care of Richmond and regenerative medicine in 2018. And working with them and for them, I learned a lot about their regenerative medicine using stem cell procedure. I attended a lot of seminars through my work, so I really got a great education. And I was also a college athlete in the 90s. And in the course of playing volleyball in college, I tore my ACL in my left knee twice. So I had two major surgeries, one in 1994 and one in 1995. And then I went on to have another knee surgery where the orthopedic surgeon cleaned out my knee, and that happened in 2013. So my knee's been through quite a lot. In October of 2020, I was at the gym working out and I really overdid it. I strained my knee and I immediately felt a lot of pain. I started almost immediately, I started resting it, icing it, doing all those normal things, hoping the swelling would go down. I could still walk, but it was just very painful. And then from there, the pain just never would subside. It got to the point where my knee actually felt like it was locking and clicking. I could feel a grinding in my left knee. And so I went to see two different orthopedic surgeons. Both of those orthopedic surgeons recommended that I have knee replacement surgery. And I was really shocked because I felt like I was too young for knee replacement surgery, but I was wrapping my knee every day. I couldn't go up and down stairs. I had to go one step at a time. I also could not walk. I couldn't run. Every time I went to sit down or stand up, I had to stop and almost unlock my knee because my left knee was locked. So getting in and out of the car was difficult. I have young daughters and I couldn't really play with them. It was very, very difficult, and my quality of life had really diminished. And this was going on about 6 weeks. And again, during that course of that 6 weeks, I saw two orthopedic surgeons. Both said there's really nothing they could do with my knee as far as any kind of cleaning it out or going into any orthoscopic surgery. So I decided to get an MRI because I thought, well, maybe they'll see something in the MRI. I thought maybe something was torn. Well, during the course of that, Dr. Snyder reached out, and because I work for them, had said, hey, we have an opportunity if you would like to have some stem cell therapy, some regenerative medicine using stem cells. We'll also add some PRP and we'll put that in both of your knees. So I jumped at that chance. And after the procedure itself didn't hurt, it was a little uncomfortable. There was a lot of fluid because they were injecting both of my knees. It took about 15 minutes max. And again, I got the regenerative medicine using stem cells, and they also added some PRP. So had that done in both knees. I just really took it easy the rest of the day. I followed all the instructions, and the first 3 months, I only noticed minimal difference. I was worried it didn't work. I, again, was having a lot of swelling, but I was taking it easy, following all the instructions. So, and I had that done in November of last year. In February, early February, I suddenly noticed almost no pain. I could go up and down stairs. I felt strength in my knee where there was a ton of weakness. I could walk normally with a normal gait. I had no more need to wrap my knee. Again, it was a complete miracle. I could go up and down, get up and down, sit up and down, no problem. Everything changed. It just, I could not believe it. I was so grateful that I did not have a knee replacement because I didn't need it any longer. So someone who has gone through a tremendous amount of destruction, if you will, on my knee, I've had the regenerative medicine using stem cells and the PRP, and it has worked. It has been absolutely amazing. My quality of life, I'm back to playing softball with my kids. I'm going up and down stairs. I'm walking 10,000 steps at least a day. I've started working out again, so I feel great, and I highly recommend that you try this procedure.